Surgical anatomy of esophagus. 1. A 73-year-old male, a known alcoholic, is a driver by profession. He came to the OPD after prolonged symptoms of heartburn. His pulse was 80 beats per minute, BP 120/80ths of a millimeter of Hg. On abdominal examination no abnormality was detected. He was ordered an endoscopy. The endoscopist noted a growth at 22 centimeters. Which of the following statements regarding division and landmark of esophagus are correct? A. Upper thoracic esophagus, sternal notch to upper border of azygous vein. B. Upper thoracic esophagus, sternal notch to lower border of azygous vein. C. Middle thoracic esophagus, lower border of azygous vein to lower of inferior pulmonary vein. D. Middle thoracic esophagus, upper border of azygous vein to lower of inferior pulmonary vein. Ans B. Upper thoracic esophagus, sternal notch to lower border of azygous vein. Ref. Shackelford Surgery of the Alimentary Tract 8th edition Chapter 4 Relevant anatomic relations of the esophagus page 31, 33, 39. The esophageal bed lies in the posterior mediastinum along the ventral surface of the vertebra. This is the shortest distance for reconstruction after esophagectomy and measures approximately 30 centimeters. When the orthotopic route is not available due to previous surgery, the retrosternal or subcutaneous routes are alternatives. 2, 3. On endoscopy, the upper esophageal sphincter is approximately 15 centimeters from the incisors, the carina at 25 centimeters, and the lower esophageal sphincter at 38 to 40 centimeters in men and 36 to 38 centimeters in women. There are three anatomic narrowings of the esophagus. The narrowest part of the gastrointestinal tract is at the cricopharyngeal constriction at the upper esophageal sphincter, where the esophagus is 1.5 centimeters in diameter. In the superior mediastinum, the aortic arch, left atrium, and left mainstem bronchus compress the left anterolateral aspect of the esophagus around 22 centimeters from the incisors. The third area of narrowing is at the lower esophageal sphincter. Cervical esophagus. The cervical esophagus shifts to the left at the base of the neck, so the best approach to the cervical esophagus is a left neck incision. The cervical esophagus is 5 centimeters in length, and extends from the cricoid cartilage at the C6 vertebra to the suprasternal notch. Abdominal esophagus. The abdominal esophagus and proximal stomach are approached through a laparotomy or laparoscopy. Normally, the abdominal esophagus is 3 to 6 centimeters in length. The abdominal esophagus angulates to the left after passing through the diaphragmatic hiatus, and care must be taken to carefully guide an esophageal bougie during a Nissen fund application or a rigid esophagus go through this area to avoid perforation. This is Nerd Speak. I am happy to help.